Hi everyone, I'm Dr. Akhila, consultant fertility specialist, Sudha Hospital, Banjara Hills, Hyderabad. Today we are going to talk about care after embryo transfer. What are the things we are supposed to do, what we must avoid after embryo transfer. So typically, after the embryo transfer, we need to follow the medicines that are given very religiously. We need to time the medicines and not miss any of the injections or tablets that are prescribed. This is of paramount importance. The other things that include in care after embryo transfer are food. There is no specific diet that needs to be followed. Healthy diet is what we recommend. Less of spice and less of oily food. This is because to avoid any kind of gastric upset, so to avoid unnecessary intake of other medicines. But otherwise, what a woman wants to eat, what she feels like eating, how much she feels like eating, she can continue to take that. There is no per se restriction in food. She can take whatever she feels like eating and how much ever she feels like eating. This is about food. It is important to stay hydrated. 6 to 8 glasses of water is what we recommend. And healthy diet, of course, which includes fruits, vegetables, nuts, seeds, dry fruits. These are something that is important. High protein diet and normal good healthy diet is what we recommend. Uh, Next, how much to rest? It's a very important question that most women ask whether they require bed rest or not. So, typically, after embryo transfer, we get the woman to lie down in supine position, that is, lying down flat, for a period of 15 to 20 minutes, which is more than enough. There is no other rest required apart from the rest that we give in the hospital. Bed rest as such is definitely not required, and it rather is a little detrimental. Women, they can do their household work or office work or climbing stairs. All this is something that we don't restrict. She can do all these activities. Going to the office is also allowed. Taking rest for about 2 weeks is definitely not required. And coming to the household work, she can continue to do all her work as long as she's feeling comfortable, she's not stressed out. Excess physical strain is something we tell them to avoid. Cooking can be done if she's comfortable. Prolonged standing is something we avoid. These are some of climbing stairs. Definitely, we can climb stairs. Uh, Avoid uh, strenuous physical exercise like gymming or these heavy running. These are something we tell them to avoid, but otherwise, no rest is recommended. They can continue their daily routine. Sleep, very important to have catch about 6 to 8 hours of sleep. uh, Avoid stress, try to keep yourself as happy as possible, and it is very important to take it easy the next 2 weeks and wait for the result. In these 2 weeks, you can try to de-stress yourself and probably meditation, minimal yogas, and all these can be advised. The other thing is if you are feeling stressed out, these are some of the things that you can do to keep yourself happy, but stress per se does not cause a negative result or a positive result. It has no connection. And so we've talked about food, rest, stress, and staying hydrated. Another important point is about intercourse. Most couples ask whether they should or shouldn't have intercourse. So it is as such not restricted, but it is better to avoid intercourse in this time frame. And medicines, very important to take medicines regularly. Um, these are some of the things that we recommend most people after an embryo transfer. Some of the signs that you must be cautious about after symptoms and signs after embryo transfer. One, if there is any cramping, mild cramping is something we can expect, but if the cramping is unbearable, you're not able to tolerate that kind of cramping, that's when you need to talk to your physician. But a little cramping in the abdomen, that's okay with a small medicine, or you're fine after a little bit of cramping. You need not worry at all. Spotting, mild spotting can be expected, but if it is bleeding or if it is heavy period with pain or heavy, then you definitely need to contact your physician regarding the same. So these two are the symptoms that we must keep in mind. If you're having severe nausea, diarrhea, something like that, obviously these symptoms you need to explain to your physician, and they will look into it as to what to do about it. Some women may complain of these kind of nausea, uh, tiredness, fatigue, uh, non-specific symptoms, and they can correlate this to pregnancy. These kind of symptoms can also happen because of the injections of the medicines that you're taking routinely as a part of an IVF treatment. And the pregnancy test typically is done 2 weeks after the embryo transfer. So there is no need to do these pregnancy tests before. If you end up doing it before, you may get a negative result as well. So these are this is the time frame where in 2 weeks we will do a pregnancy test in the form of beta HCG and urine pregnancy test. So in these 2 weeks, we need to avoid smoking, alcohol, and long distance travel, multiple travels. Always is better to avoid. Um, these are some of the precautions that we need to take. Importantly, it is very, you just need to relax yourself in these 2 weeks, take it easy, and hope for the best result. Any questions, please? Okay, compared to a fresh and a frozen embryo transfer, most centers nowadays go for a frozen embryo transfer. In a fresh transfer, we need to make sure that the hormones are adequate, or as in the hormones need to be at a certain level, especially the progesterones, because the pickup is done in the same cycle. Sometimes these hormones are not what we want them to be. In those cases, we cannot opt for a fresh transfer. In women with PCO who have excess of estrogen, again, we don't go for a fresh transfer. And so these women automatically going for a frozen transfer. So which is better is more than that, whatever suits the patient is something what we do. So it is a customized transfer. What works best for the patient is what we usually do. So soon after the embryo transfer, implantation happens within the next 1 to 3, in that time frame of about 3 days. So that's when the implantation typically takes place, 1 or 2 in that time frame, uh, 24 to 48 hours. So, but what we need to understand is that once the embryo is put inside, we use a catheter, a thin catheter, and an embryo is placed inside the uterine cavity, which is a closed cavity. So once the embryo is put inside, after the rest of about 15 to 20 minutes that we give in the hospital, no further rest is required, and it does not mean that once the embryo is put inside, it will fall out. Whether it implants or no is something that we need to look into, but that much rest is sufficient. Can I travel after embryo? Definitely, travel is something that you can do. Some women, they get the transfer and immediately they want to go even outside of India, which is allowed as long as you're taking your medicines correctly without missing any of the injections. That is Diet after embryo transfer, like I have already mentioned, it's a healthy diet that we're looking at. Fruits, vegetables, nuts, seeds, these are multivitamins that we usually give. These are something that need to be taken. Avoid alcohol, avoid smoking, uh, stay hydrated. This is the diet per se. There is no food restriction. Uh, Less oily, less spicy food is better. Fever is definitely not normal. We don't expect any fever after embryo transfer. Should you have any fever, you should contact your physician and find out the cause for it and adequate treatment. There are no as such symptoms of implantation. Some women may experience implantation bleeding, that is mild spotting, but there are no otherwise symptoms of implantation. The symptoms that I have already said, some women can experience fatigue, some women can experience nausea and tiredness and breast discomfort. Then they attribute all these symptoms to pregnancy, but these symptoms can also happen because of the injections and the progesterones that we take. Thank you so much.